Township Board of Health is called to order. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. What I'd like to do now is to have, let's take a second or two and review the minutes which were sent with your meeting packets. Those would be the minutes of the December 20th, 2010 meeting. And I'll entertain a motion to approve the minutes.
So moved.
Any seconds?
Second.
Thank you. All in favor? Aye. Any contraries? The minutes are approved as submitted. And again, thank you to Allison Moser Mills for an excellent job. At this point, I'd like to introduce our newest member of the Board of Health, Ms. Kellyanne Doyle. Welcome, Ms. Doyle, and it's great having you here, and we look forward to working with you and your contributions to the board. If you don't mind, I'd like you to maybe take a few minutes and tell us something about yourself and maybe what you would like to accomplish working with us.
My name is Kelly, and I am a registered nurse. Oh, sorry. Hi, my name is Kelly. I'm a registered nurse. I have lived in Radnor for about 12 years. I just finished grad school in August. I started a new job in October as chief nursing officer of a orthopedic specialty hospital. I've been a nurse for 23 years, and I look forward to serving the community.
Thank you very much.
Thank you.
Appreciate that. The next item on our agenda is the calls for the election of board officers for 2011. And at this point, I'd like to delegate the chairing of this portion of the meeting to Dr. Offit. Dr. Offit, would you mind taking over the chair temporarily and, to preside over the election of officers? And what you
Certainly.
can do is ask for nominations.
So at this time, I'd like to ask for any nominations for board officers for 2011.
I'd like to nominate Herb Hazen as chair.
Second? Are there any other nominations? No? Then we will close the nominations. All in favor? Aye. Any opposed? Thank you.
Thank you very much. That's a great vote of confidence, and either that or no one else really wants to do it. But either way, I feel very gratified that over this vote, and I'm looking forward to another great year of accomplishments. At this point, I'd like to entertain nominations for Vice President of the Board.
I would like to nominate Amy Wishner as Vice President.
I'd like to second that. Any other nominations? Hearing none, I'll call for the vote. All in favor, say aye. Aye. Any contraries? By unanimous acclaim, Amy Wishner is elected Vice President of the Board of Health for the calendar year 2011. And thank you very much, Amy, for your continued willingness to serve this board. At this point, I'd like Mr. Taltone, our health officer, to cover items 6 and 7, announcements and health officer's report.
Good afternoon to the members of the Board of Health. We were unfortunate that we didn't have a meeting in December. So in your packet, you'll find a summary of the 2010 year and the report for January of 2011. I have 2010 there. I'm still trying to get used to that. Also in your packet, what you'll find today was not in your packet, I'm sorry, is a flyer regarding the REACH meeting, and I'm going to yield to Mrs. Wishner on that a little bit later. She can explain a little bit more about the program. For the year of 2010, we were able to do 258 food safety inspections, 112 bathing places, 46 rental housing inspections, and we handled 109 quality of life concerns for the residents of Radnor Township. In January of this year, we were able to do 17 food safety inspections. The reason that number is so low is that, it's the renewal time for the food licenses, and there's a lot of work that goes into that, verifying the number of seats that they have, certified food managers that's required per establishment. And just prior to the Governor Rendell going out of office, some new regulations went into effect, which requires that a certified food safety person in a supervisory position be on every shift rather than just one being employed for the food establishment. Also, one of those components is that the Department of Agriculture now requires, upon their request, 30 days after an inspection, that we provide them with our inspection reports so that they have the capability of putting them online. Now, what that means is that I have a lot of concern with some restaurants worried about their inspections being online, which I think that's sort of a non-problem for me, because if they're in compliance, they shouldn't have a problem with that. But it doesn't mean that it's going to automatically be online. If agriculture says, send them to me, we're capable of doing that. So those are some of the changes that went into effect. Food establishments in Radnor Township are going crazy, and it's a good thing because we have a lot of them coming. I have on my desk right now probably 7 or 8 plan reviews that food establishments that are in the process or coming in, and at least once a month we have at least 3 or 4 different inquiries about different locations, and people want to come in. So it's a great place to be. As always, I try to send you Pennsylvania Health Alert Network alerts, advisories as I get them. If anyone wants hard copies in their subsequent reports, please let me know. I'll try to include them. Sometimes they're kind of lengthy, so I don't normally put the whole reports in. So ends my report, if there's any particular questions.
Thank you very much, Mr. Taltone. Are there any questions regarding the health officer's report?
I had one. Larry, it just wasn't entirely clear to me. You say there's a possibility that the restaurant inspections will be online, or they will be online, or?
Yes, what Department of Agriculture, what they actually told us about 3 years ago was that this was going to happen, and that we had to use their program or we could get permission to mimic their program. What we did was we got permission to copy their program. So we've been ready 2 years ago for this to happen. The governor signed it and said that when they make the inquiry or the request of you, you have to send them in 30 days. So I'm ready. We've been ready. But it's up to them to make the inquiry. We just can't send them to them.
And then there'd be a way for the public to search?
You'll be able to go on the Pennsylvania Department of Agriculture's website and look at a certain food facility to see if you want to go there and eat. Public record.
I mean, that's interesting because I had heard in certain townships that already exists. So is that just they already were asked?
Well,
by
in certain parts of the state, the Department of Agriculture does food safety inspections. And those locations where they inspect, that capability exists of the ones that they inspect. What they're doing is trying to bring everybody under the umbrella, which I think is past due. So I asked the question as to why it's going to take a while. I mean, why they may request and why they may not. And they're saying they have to promulgate the rules, and that may take them some time. So, but we're ready. If they call tomorrow, I can send them to them. Or if a resident, not to prolong the conversation, but if a resident wants to know about a certain restaurant, they can make a request for a right to know.
Any further questions of Mr. Tautone? Okay, we'll move on to old business, but before we do, I'd like to take this opportunity to congratulate John Fisher on his election to the presidency of the Radnor Township Board of Commissioners. Congratulations, John, and it's a great thing for the township to have a great public servant such as yourself step forward in that position. And we're also happy that you're still the liaison to this board. So again, we look forward to continuing to work with you.
Thank you.
If you wanted to say anything at this time, or
Well, I just want to thank you for that, and I guess I won't be able to make any excuses now. If something doesn't get on the agenda, the buck stops here. So we'll talk about that under old business. We have some things that we have to get to on the Board of Commissioners side. So thank you.
thank you for that. I also, again, just before we get on to old business, I think in everybody's packet, Mr. Tautone will correct me if I'm wrong on that, we all need to complete the Radnor Township real estate disclosure form. If you haven't done it yet, please do so. Note that they have to be in Mr. Zinkowski's office by March the 1st of this year. So again, if you haven't done that yet, please do so as promptly as possible, but certainly no later than March 1st. Okay, the first item under old business is the Delaware County Department of Public Health. As everybody probably recalls, just to recap, this board did adopt a position paper which we recommending the establishment of a county-wide board of Department of Health for the for Delaware County, and we passed that on to the Board of Commissioners with their recommendation that they support our action, which the Board of Commissioners did. By a vote of 5-2, they adopted a resolution urging the Delaware County Council to take the steps that would lead to the creation of a county-wide Department of Public Health. As part of that process, a letter was prepared to go to all of the members of the County Council, so urging them, and that letter accompanied the resolution, and that letter was co-signed by Mr. Fisher and Mr. Zinkowski, the township manager, and myself. And that went out probably last week, I want to say. But it's a copy of that should be in your packets as well. And I know, yeah. So that's where the matter stands. As you'll note from reading the letter, the letter does indicate that a member of the township staff will be in touch with the county council members to set up a time and place for us to have some sort of joint meeting. And it's my understanding that Mr. Zinkowski is working on that, to implement that, hopefully by inviting the county council members and perhaps some appropriate staff from the county government to meet with us here. But we'll have further updates as time goes on in that process. As I said, Mr. Zinkowski is trying to set up that meeting right now. And again, that's where that stands. In addition, I have contacted the Dean of the School of Public Health of Drexel University, but at this point in time, Drexel, because of the fact of the involvement of Johns Hopkins University in a study of the health status of Delaware County residents, was peripherally involved or involved only by implication in the issue of a countywide Department of Public Health. Drexel does not see themselves as the lead institution at this point in time, at any rate. In connection with Drexel's involvement, you also have in your packets a copy of their feasibility study, at least the executive summary of their feasibility study, which they did in September of 2005 for the, they submitted their report in 2005 to York County, in which they did recommend a countywide Department of Public Health for that county. My understanding is that action has not been taken on that recommendation yet, and Mr. Taltone was kind enough to get me a list of people that I might contact with regard to finding out what their thinking is currently, how they received the report, and what specifically went on, if they'll share that information with me. And I haven't not had a chance to follow up with the contacts at this point, but I will certainly do that before our next meeting and report back to this board on that. I think it's an enormously important issue, obviously, and I know that the members of this board share that view. Are there any questions about that before we move on to the next item?
Well, just a comment in that I am going to go to that Delaware County Medical Reserve Corps training, and Maureen Hennessy Herman is going to be there because I spoke to her about it. So I can also talk with her, then.
Would you say who that is?
Maureen Hennessy Herman. Isn't she the head of the what is her title?
She's the Director of Intercommunity Health.
Thank you.
Okay, thank you for that, and we'll look forward to the results of your conversation with Ms. Herman. Any other questions, comments on the countywide Department of Public Health? Hearing none, we'll move on to teen health issues, and I'd like to ask Dr. Leader to lead that phase of our discussion.
Sure, and I'll give a brief update, and then I'll pass it over to Allison. She and I have been working together to coordinate the Radnor Health Matters on teen issues, and we're making some pretty good progress of taping in Radnor High School. And our idea is to supplement whatever interviewing that we do with the experts, to supplement that with some taping of some Radnor students related to these things, similar questions of, how many hours did you sleep last night, and then talk about sleep, so that it becomes much more of an interactive dialogue. And so, Allison, I'll pass it over to you on sort of our current status at Radnor and what we've been doing and how it's going.
Well, so far we compiled a list of questions for each of the 3 topics, and we contacted Mr. Skellinger, who's the principal of Radnor, and he agreed to meet with me to discuss the questions. And I sent him an email asking when he wanted to schedule it, and he hasn't replied yet, but I think I'm going to go and stop by his office sometime this week and talk about when we could potentially film and different ideas for how to handle issues of liability and giving out permission slips, essentially, for the students, that if their parents had any questions about why they were being filmed or for what the purpose was, they would have a number to call and they could ask about it. So that's where we are now, and we're hoping to move forward with it.
we had an email conversation back and forth between Allison, myself, and Mr. Solinger, the principal there. And he's very interested in and was all for the idea of doing it, and just wanted to see the questions that we might ask. And so Allison submitted the questions, and he also had some questions. Of course, these are minors, and so how would we handle what the questions are, and issues of do we need consent, and how would parents know, and if they have any questions, what could they do? And so I agreed to talk to him after he saw the questions, and I was going to share with him some of the ways that I work with some of the minors in Philadelphia, and in terms of consent, and if it's just basic questions and providing phone numbers, and so we'll go from there. But he seemed pretty open to it. He just wants to figure out the best way to do the logistics. So.
Any questions from anybody on that? You've made some good progress, and I hope that the meeting with Mr. Skellinger takes place as promptly as possible so that we can begin. Have either of you had occasion to contact Lisa Williamson, the Director of Communications for the district? I know in some cases with this kind of thing, she can be very helpful.
I have not, and if you can provide me with her information, I will.
I will right after the meeting, certainly.
That's fine. That's fine. And I actually had a question. I was thinking about it, potentially for you or maybe for Larry. In terms of if we were to go do taping over on the high school, I know we have the room here, but is there any way for us to take a camera or a person over? Or would we have to do that sort of figure out those logistics on ourselves? Is anything in there mobile to go over to Radnor one morning and tape or something?
Give me about 5 minutes. I'll give you an answer.
On the website, on the township website, you're looking at exercise and sleep and nutrition. I'm just curious how you came up with, how did you focus on those things? What is it that you are looking for?
So in the fall, we came up with a list, mostly us, we came up with a list of a whole bunch of ideas. And then Allison took our list over to high school and started asking the teens which one of these would be most interesting to them and what do they want to know more about. And then we narrowed it down a little bit, and then Allison came back and we talked about it a little bit more, about where we thought we could bring experts in to talk about things. And so a little bit of our own feedback and a little bit of the teens. Yeah.
Dr. Leader? Jim Doling from IT department said absolutely we can do it.
Fantastic.
So one more just for timeline, our goal would be hopefully to do that taping part as soon as spring comes around and we can actually hang outside and not freeze. So maybe April, early April. At this rate, you know. That's our goal, is to work out these logistics in the next couple of weeks so that as soon as some nice weather comes around, we can go over.
Yes, and hopefully we'll have no more of the false alarms. This weather is particularly awful after Friday. Yeah, that's good progress. Ms. Doyle, just to, by way of a little bit further fill-in, we've had a occasional series called Radnor Health Matters on the Township's cable channel, which is 30 if you have Verizon, and I think it's 10 if you have Comcast. We've done programs on HPV and flu, and among others. And we're going to, we've sort of informally, but at a public meeting, declared this year to be the year of the teen, and so we're going to be focusing on teen health issues. And Dr. Leader and Ms. Mosier Mills, our intern, have both taken the lead in helping us to get there. Okay. Amy Wishner will ask you about Radnor Reach at this point.
So Radnor Reach has 2 upcoming meetings, and Radnor Reach is sort of a place for parents to sort of share, learn from, hopefully come to some better ways of dealing with some of the social and sort of combined health issues that kids face in terms of drinking, mental health, pressure for grades, So I guess there's a sort of a feeling that that there's a certain amount of lip service paid to some of these issues, and people say, oh yeah, I would never do this, but somewhere, some parent is serving alcohol at the parties. So kind of a desire to be very sort of realistic and try and find some, good ways of dealing with some of these problems, and to maybe be more open about what some of the problems are, in fact. So they have two things coming up. One is a coffee shop discussion, 7 to 9 p.m. on Tuesday, March 15th at the Wayne train station, Fabio and Danny's Cafe. And I can go to that one. And then their next thing is, gosh, I don't remember when they said it was. She just emailed me today because they had these two things coming up. I meant to print it out, obviously didn't. I will have to, are there two things listed? There's just the one, right?
Just the one.
Yeah. I'll have to forward that email. This was all happening as I was ready to walk out the door at work. So anyway, but the first one is Tuesday, March 15th. The other one was later than that. I remember that. So I will, so we should be able to add that into the notes. Hopefully I'll send that on.
Thank you. If we can get that, as far as your recollection is concerned, I think that is in early April, and that might be a daytime meeting. And I seem to recall you're indicating that you could not attend that meeting whenever it is, but we better get some clarification on that. And at that point, we'll ask for someone to sub for Amy in representing this board. I think it's very important that we be at the table, especially since we're addressing teen health issues, and this is really part of that as well. Okay. Genevieve Burns was unable to be with us this evening. She is this board's liaison to the Environmental Advisory Council, which is what EAC stands for on your agendas. And so she is not here to give us a report of any meetings that she has attended since our last meeting. I should indicate, though, that I have been in touch with Brenda Gotanda, who chairs the EAC, with regard to our work in connection with the Delaware County Department of Public Health. I can't imagine that any such department would not have a unit that would, or a function dealing with environmental health. And so they are concerned, and they have discussed the issue at their meetings and are gung-ho to support us in that effort. And I'm thinking now that we should probably be certain to let them know when the meeting that Mr. Zinkowski is working on is set up, so that representatives from the EAC can also attend. There's an additional item that I think Mr. Fisher alluded to before, and in your packets is a copy of an article that I found quite by accident from the Sunday News, Lancaster Sunday News. Feral cats are an issue that we have discussed here in connection with our work on recommending revisions to Chapter 115, the Township's Animal Control Ordinance, to our Board of Commissioners. As you can see from the article, Lancaster County, the Humane League of Lancaster County received a grant from PetSmart Charities to tackle the feral cat problem. They have a pretty big problem there. The article indicates they have 5,000 plus. What they're using is something we heard about from public testimony at an early meeting last fall, or maybe even earlier than that, which involves, in brief, capturing the feral cats, spaying them and neutering them, and then releasing them. And the idea is that once they are spayed or neutered, they can't reproduce, and they can live out their lives, but without causing an increase in the feral cat population. At some point, when we have the issue of Chapter 115, or we can probably move forward in tandem with that, and my thought is to work with Len Donato, who is a member of our board and a veterinarian, to be the lead person in helping us formulate an approach to getting a similar grant, which might be very helpful. I don't know what group would be the recipient of that grant, whether it would be the township directly or some other organization. Len has worked with organizations in the past on this issue, and he would have probably a good notion as to how to proceed on that. But again, he could not be with us tonight. So we'll follow up on that, and we'll hopefully have a more complete report on that part of the issue. But in connection with Chapter 115, Mr. Fisher, do you have any updates for us?
Herb. I just want to comment. PetSmart Charities is the actual address on the website, petsmartcharities.org, and they actually show two different grant programs that they offer. One is a spay-neuter program for free-roaming cats, and the other is a targeted spay-neuter program. So I imagine we'll be able to make an application directly to them, either from the Board of Health or from staff on the township side. As far as Ordinance 115, there's been a change the way the Board of Commissioners are operating at this point. Up until this point, I'd say up until last year, the Board of Commissioners generally met twice a month, and the various subcommittees that the Board of Commissioners had were not very active. Beginning this year, the Board of Commissioners are going to attempt to meet more often and to meet in committee, and the Public Health Committee will most likely meet on March 22nd. It's Tuesday, March 22nd, to address the amendment to Ordinance 115, the ordinance that this committee, Board of Health Committee, had worked on and produced a draft for that amendment. What we hope to do is address that in a public meeting, a televised public meeting, and advertise it as such, and try to get the public to come out and comment on that. The hope is to do some of this work off of the normally scheduled Board of Commissioner meetings, and try to offload some of this work to subcommittees so that we can get more done. We have a lot to do this year. We have a new manager in place. We have a new superintendent of police. We have a new director of finance on the last year. And we have a lot of initiatives that we have to get back moving again. And this will certainly be a way to get that done. So look for that meeting on March 22nd. If I cannot get that meeting to happen, what I'll most likely do is move that ordinance Ordinance 115 amendment to the Board of Commissioners meeting on Monday, March 28th. So that's the goal, and the hope is to at least have that public discussion. I can't guarantee or promise you that amendment will be introduced or voted on at that point, but we'll at least have a discussion and try to move that further.
John, just a quick question. So this is a subcommittee of the commissioners that meets, and then it would make a recommendation to make changes or whatever, and then bring that to the board in plenum, the commissioners in plenum.
That's right. The idea is just to try to offload some of the more complex issues from the normal meetings, where we tend to do more cursory type business, trying to keep the government moving, the township government moving along. Any issues that have contention or may take more time, we want to offload to committee. Idea is not to keep it in committee. The idea is just to have at least 1 or 2 meetings on it, and then immediately get it to the Board of Commissioners. The Board of Health Committee will probably only, I'm sorry, the subcommittee of the Board of Commissioners on Board of Health will only meet about 4 times a year. I think we have about 6 or 7 committees that have to meet, and if you start to add them up, pretty much we would be at meetings every day of the week, so I don't think that'll happen. But the hope is to at least have 4 substantive meetings a year, again, to air these types of changes, to get some momentum, and then get it into the Board of Commissioners for a vote.
Do we have any sense how many people have looked at the proposed changes that have been on the website for the past couple months? Has that gotten any traction or commentary at all that we know of?
Well, we don't have a way to track that, but the amendment was given to all the Board of Commissioners for comment and their thoughts. And I think at the time, I believe that was given to us in the fall, late towards December. I think we were dealing with a budget at that moment, a very difficult budget. And I think the commissioners probably let it fall off their radar. But my hope is to kind of reinvigorate it, get it moving again, get some momentum behind it, and try to get that at least to be aired and discussed. And hopefully the draft that you've come up with will be seen as the best version, and we won't see any need to change it.
And, in addition, just for the, it was put on the website to allow for public comment, because we had some preliminary discussions here, and then we did, a draft that hopefully was going to be suitable, but we wanted the public to have opportunity to comment. But do we know if anybody's had any reaction or?
Well, let me tell you the processes that it will go through. It'll go to subcommittee first, just as a discussion piece. But then eventually, when it gets to the Board of Commissioners, it will be introduced as an ordinance. If we have the votes to get introduced, it'll be introduced. And then for a period of 30 days, it'll be in the public view. And at that point, we'll have a hearing and then subsequent adoption. The hearing and adoption can happen in the same night, but it has to be at least 30 days after the introduction. So my hope is that during that introduction phase and that 30-day grace period, that people will have a chance to weigh in and give us their opinion. I think there'll be a lot of opinions on that particular ordinance amendment, because we're changing the scope of that ordinance. And I know initially when that ordinance was discussed in this committee that I did get some negative feedback saying, don't tell me how to care for my cat, and but rather than get into a discussion, let's allow that to be a public discussion and a public airing of that and see where it goes.
In addition, just historically, when we adopted the final draft prior to sending it on to the Board of Commissioners, it was at a public meeting which was duly advertised. I don't recall now that there was any public testimony, though, at that point, but there could have been. So, but the process that Mr. Fisher has outlined, the 30-day period, is usually the opportunity for people to come to some positions on how they feel about the proposal, and then they could come to the second meeting prior to the vote and tell the commissioners what their thinking is. Any other questions?
Larry, can this still be accessed on the website, the draft?
I'm not certain. I can check with Jim.
I think it might be wise to put it up again.
I see the link there. I haven't clicked on it, though, recently, but the link is there right on the first page, but I don't know if it's active.
I just have a quick question. The time that it does come up to public comment and voting, will we know ahead of time so that maybe we could attend and listen to that?
Absolutely, yes. The answer is an unequivocal yes. And as always, the more of us that can be in attendance, I never know what sorts of questions, and each of us brings to this body a different perspective based on our various backgrounds. So I really welcome.
Larry,
that-
the draft is on the website, on the Board of Health page. There is a link to the proposed revisions to Chapter 115.
Okay, so it's still there for anyone who wants to access it. And are there any other questions with regard to the animal control ordinance? Dr. Leader?
Well, this is just a quick question we were just sort of talking about. If someone did happen to see that link on the website right now and they did want to comment, what would be the pathway that they would go about doing that?
Well, they can contact the township by calling the township. They tend to email the commissioners directly. All of our email links are listed on the Board of Commissioners page. But we don't actually have a survey tool set up, and that's something we've been talking about. I've been talking about for about 2 years now, to build in some survey tool that allows us to collect information via the web on many different issues. But this would be a good opportunity. So I'll discuss that with the township manager and see if there's any functionality that we currently have for a survey.
Any other comments or questions on this particular issue? Okay, we'll look forward to further developments that will be coming up shortly. At this point, I'd like to ask if there are any items for new business from any of the members.
I wanted to raise a question for discussion, and it comes out of learning that we not only need a quorum for a vote, but we need a quorum to actually meet. And we had a little bit of email back and forth, and the question that I wanted to raise is the meeting time difficult for people to get here for 5 o'clock, and then it increases our risk of not having a quorum to not be able to meet and then move forward some of these initiatives. And I ask it totally as a neutral question, but I know that the last meeting that got canceled was because a number of people couldn't make it for work-related issues. So I'd just throw it out there for discussion.
Well, I don't know. For myself, it's not an issue. The only issue that with having a later meeting would be bumping up against other meetings. For example, tonight the Radnor Township School Board is meeting in this room, so we do need to be out of here by 6 o'clock, and that seems to happen fairly frequently. That said, I don't really have an issue with trying to work with township management to find a better meeting time or day or whatever, if that's the consensus of this group. So, anyone else who wants to comment on it, please do so.
For me, I couldn't make the last meeting, and sometimes can't if I'm out of town for something work-related. So it wasn't actually a time issue for me. I personally don't have a issue with the time, although I would be happy to, change the day or time if it worked better for, more people more of the time. So maybe we should do a little, survey. And it might be good to know. So for me, that's the only reason that I'm not here, is if I'm physically out of town. So for me, the time wouldn't make a difference, but maybe for some of the other people, like Dr. Donato has, several times been unable to meet, maybe to ask. Does it make a difference for you now to meet later?
I mean, it's certainly easier later, but I can try to accommodate as much as I can. But that wasn't really the origin of the question, just because, and I don't know if it was just my perception that there had been a number of people that, due to work-related issues, and given that it's a volunteer position, this may be the thing that has to drop if someone has a demand in their day job. But I'd be happy to take as an action just sending out a let me know, and then I'll just collect it all and anonymize it and just say this is kind of what people's thoughts are, because it may just have been that one meeting that it just struck me, and then at least we'll have some information to go on.
I was going to suggest we take this offline and do exactly what you're suggesting.
It's probably more of an issue for the people who aren't here. So we may want to know if this is not the best time for them. So yeah, I think that's a great idea.
I think none of the people who were absent this evening indicated to me that the start time was a problem. Being out of the area was the issue. But thank you, Dr. Offit, for taking on that responsibility. Look forward to hearing the response.
Just a shame that we have to cancel. We can't even meet to just discuss. That's a shame, just because once a month is not that often. So.
Yeah, that came as a surprise to me. That because by the time our meeting night comes about, it has already been duly advertised, so that any members of the public who wanted to be here to even see us discuss issues without voting on them and to contribute to that discussion would be turned away. So I think that's bad PR for the township's government to do that. We welcome people. Obviously, we don't have public comment that often. And if we did have it, I'd really feel very badly to have to turn them away because we didn't have a quorum. I understand that we need a quorum to vote. That's fairly well established, but it came as a surprise to me that we couldn't even talk about anything together at a public meeting that's been duly advertised.
Herb, I'd like to comment that the school board normally meets, I believe, on the third Tuesday of the month. And the reason there's a conflict tonight is because you've shifted your meeting. But I did look out the next 3 months. It looks like there doesn't appear to be any conflict on Mondays. However, the Planning Commission does sometimes schedule additional meetings, and there are other boards and commissions that actually are as needed. So sometimes they get dropped in on the schedule. But if you were to pick a later time on a Monday, I would say it probably would be okay, but we'd want to clear that with staff.
Yeah, I just used the school board meeting as an example for tonight. Had we met last month, which we did not because of a lack of a quorum, we would have had to leave this meeting room at 6 o'clock because Mr. Bauman, the Director of Community Development, was convening a meeting, I've forgotten what group, at 6 or shortly thereafter, that the evening of our regularly scheduled meeting.
They actually worked around our scheduler for that, though.
Well,
We set your time and date, and we kind of fill in when we can, like, other meetings.
well, we're going to follow up with that and see what we can do. Other new business?
Two things. One is I just want to remind anybody who's listening that influenza season is upon us. The circulating viruses do match very well this year's flu vaccine, so it's very effective. And the influenza vaccine, the injectable or the intranasal, is the best way to prevent influenza. And sort of second to that is the cover your cough, wash your hands, stay home if you're sick. But the vaccine is far and away the best way to prevent influenza. And, just as a reminder, you can spread the disease before you become symptomatic. So thinking that, you can just wait, and if you would be ill, you would stay home, isn't really good enough. And there have been 35 pediatric flu deaths in Pennsylvania as of last Friday. And I don't know the stories of all of them. I mean, I know some of them. And the ones, the ones that I do know, preventable, previously healthy children, eligible for vaccine. And, make sure that you get yourself immunized to protect anyone around you who can't be immunized and, who's too young to receive immunization. And, make sure you get your kids immunized. It's not too late to get your flu vaccine. So that's one thing.
Well, before we leave that, I just want to underscore that because I've been asked and I've overheard conversations in which I've butted in because people think because spring is coming next month that it may be too late to get their flu vaccinations. And as we've just heard Amy Wishner say, that is not the case. It is not too late to get your flu immunizations for this season. Thank you. Any other items?
There is an item in our packet, but I just wanted to announce it for anybody who's listening. The Delaware County Medical Reserve Corps is having an orientation Wednesday, March 2nd, and it's at 200 Yale Avenue in Morton, PA. You can find out about the Medical Reserve Corps at www.medicalreservecorps.gov, and there's a number to call to RSVP for this particular training, 610-891-5311. And I am going to go to this. In my day job with the Pennsylvania Immunization Education Program, we're working in conjunction with Serve PA to provide immunization training to Serve PA registered people in Williamsport and in York Adams County coming up in the next couple of months. And in Delaware County is using the Serve PA database, so it's kind of all one and the same. And I did talk with Maureen Hennessy Herman, who is organizing, or who's sort of in charge of this, to say, this is one of the things we offer, and it's free. We're being funded to do this type of thing to both help, because what's happened with Serve PA and the Medical Reserve Corps is that people sign up for it and never hear anything from it ever again. So, which is not a way to maintain a network should you need it. You don't even know if the addresses or contact information you have with people are current and active. So we've been encouraging them to use, in our case, immunization, but sort of anything as a way to both just activate your network, use it as a recruiting tool, and in the case of offering immunization content, an update on vaccines, immunization, the Centers for Disease Control and Prevention just in January came out with new recommendations about relating to correct vaccine administration technique based on compiling a lot of research. So there are some new recommendations for people, and so Maureen, anyway, so it's possible that we may be offering this for Delaware County, which of course would make sense. Here I am, the head of this program, traveling to other parts of the state. You'd hope I'd offer it in my own backyard, which I'd be happy to. So anyway, so I'll keep you posted on that and as to what happens here, and certainly encourage people to sign up for the Medical Reserve Corps. We know in Radnor Township there are lots of licensed medical people from, physicians, nurses, LPNs. So anyway, certainly encourage you to sign up, because if there were an emergency, we'd need, all hands on deck. So.
Any other new business? Hearing none, this meeting stands adjourned.